Starting Finasteride. Let's set expectations. Most folks think side effects are rare. I'll keep this plain and calm. This is education, not medical advice. I am Evan Hart. This is Prostate 101. BPH means benign prostatic hyperplasia. Finasteride blocks 5-alpha reductase, so DHT drops and the prostate slowly shrinks. Expect change over 6 to 12 months. PSA means prostate-specific antigen. The FDA label says finasteride lowers serum PSA often falls by about 1/2 in 6 to 12 months. Because of that, clinicians often use the double rule. They double the on-drug PSA to judge cancer risk. Any confirmed rise on the drug, even if it looks normal, deserves attention. The label also notes a small signal for more high-grade cancers. A Cochrane review found these drugs improve urinary symptoms and lower the risk of retention and surgery with sexual trade-offs. Question: if you are on finasteride, did your PSA drop as expected? Share your trend. Next, we'll look at sexual changes. Worried about sex on finasteride? You are not alone. The numbers are not zero. In trials, decreased libido showed in 1.8% on finasteride versus 1.3% on placebo. Erectile dysfunction was about 1.3% versus 0.7%. Ejaculation problems, often low volume, were about 1.2% versus 0.7%. A meta-analysis found nearly double the risk of any sexual side effect. Real-world reports vary, and nocebo may play a role. Most appear within 3 to 6 months. Case: Dan, mid-50s, started for BPH. At week 8, he felt lower drive and a weaker climax. We cut his dose with his urologist and added nightly Tadalafil. Within 2 months, he felt near baseline. Breast tenderness or swelling can happen, and very rare male breast cancer has been reported. Skin reactions like rash, hives, or swelling are rare but serious. Stop and get care if those show up. Key point: watch early, speak up fast. Next, the part many miss: mood. Did someone say depression? Yes, it can happen on finasteride even if sex seems fine. The FDA label lists depression after approval. The United Kingdom Medicines Regulator added a 2024 warning card that tells men to watch for psychiatric symptoms, including rare suicidal thoughts. Some studies found men with persistent symptoms scored higher on depression scales. That does not prove cause for everyone, but it is a real signal. Here is my rule. If you feel unusually sad, flat, anxious, or have any thoughts of harming yourself, stop finasteride and get help right away. Call your clinician the same day. Go to urgent care if you feel unsafe. Those with a history of depression or anxiety may be at higher risk, so plan extra check-ins. I want you informed, not scared. If this kind of clear, evidence-based talk helps, subscribe for updates. You are watching Prostate 101. Next, let me show you a simple plan to reduce risk and fix problems fast. Worried about side effects? Here is good news. You can build a plan. First dose. Some clinicians try a lower daily dose or an every other day schedule when side effects appear. Evidence is limited, so this is a joint decision. Second, add a helper. A phosphodiesterase 5 inhibitor like Tadalafil can support erections and desire. In studies, men on a 5-alpha reductase drug plus Tadalafil had better sexual function than the drug alone. Ask about low-dose daily Tadalafil if ED or low libido start. Third, habits. Move your body, sleep 7 to 8 hours, and manage stress. These do not cure side effects, but they support sexual and mood health. Fourth, track. Download my 2-page side effect tracker. Log libido, erection, ejaculation, mood, breast or skin changes, and PSA dates. Share it with your clinician before month 2. If symptoms persist or feel severe, pause the drug and call. One note from the AUA guideline: 5-alpha reductase drugs work slowly. Set expectations. Next, options if finasteride is not your fit. Not easing up? You have options beyond finasteride. Dutasteride is a cousin. It blocks both enzyme types. Effectiveness and sexual risks look similar. Alpha blockers like tamsulosin relax the prostate muscle and boost flow fast. They do not change hormones, but they can cause dry orgasm and can complicate cataract surgery, so tell your eye surgeon. Procedures can remove the obstruction without hormonal effects. Urolift and Rezum are minimally invasive. TURP is a surgical standard. Erections are usually kept, though ejaculation can change with some methods. For hair loss, non-hormonal choices include topical minoxidil or platelet-rich plasma. The AUA 2024 guideline favors shared decisions. Combination therapy fits clearly enlarged glands. Compare your goals, your side effect tolerance, and your timeline. Finasteride can shrink the prostate and often halves PSA by 6 to 12 months. Sexual and mood changes are common enough to plan for. Use the tracker and talk with your clinician. Thanks for watching. If this helped, please subscribe. What is the one step you will take this week, and why?